Joining me in the studio is the author of Senate File 1 and chair of the Health and Human Services Finance and Policy Committee, Senator Michelle Benson. Welcome.
Good morning. Glad to be here.
In public testimony this week, a farmer said he would hope that you would not throw out the relief if you were unable to reach agreement on reform. What do you say to those who are concerned that the relief won't come because of holdups in the reform part?
Well, as we heard Commissioner Rothman say, he has been working on stabilizing the individual market since October of 2015, and so we look forward to seeing the proposals that he and his team have been working on. I think we can come to reform agreement with the relief. What people need to know is that if we don't act quickly on reform as well as relief, we can't impact the market for 2018 because the products for the 2018 market are actually being developed. Some of them now, but many will be developed in March, April, and then submitted to Commerce in May. And so we're trying to do two things very quickly, and we look forward to working with the governor and his team of people on finding the right answer.
The Republican plan would put caps on relief after 3 months for those who are above a certain income threshold. MMB Commissioner Myron Franz said that this creates a number of problems for his department because they would be issuing checks, that his office is not set up to handle residency and income verification, and possibly instituting this capability would take time, cost money, and increase chances of fraud. So what do you say to that?
We're working with the commissioner. We took out residency verification because the plans are required to do residency verification, and we changed the interactivity with the Department of Revenue for income verification, and so we're working very hard on meeting the commissioner's needs while still understanding that some means testing, I think, is a reasonable provision for us to consider.
So let's talk about the reform aspects of the bill.
Yes.
You had said that you were going to try to do something with reinsurance, and how would reinsurance alleviate the uncertainty in the market?
There are a few very expensive patients in the individual market, and the plans that build these insurance products don't know exactly what insurance product those individuals will enroll in, and so they have to assume that expensive people are going to come into almost each and every plan. So if we take a little reinsurance for somebody who's going to cost more than $70,000, the insurance companies then co-pay up to $250,000 so that the insurers and providers can work on containing cost for those who need the most care and are the most expensive without having to build it into every single product. And we're hoping that's how reinsurance will impact the market.
So it kind of creates a pool that people can draw on for these very expensive cases.
And it's not a pool that we put people into, but it is on a claim basis so that we're not stigmatizing anybody. If you need the care, you get the care, but the insurance providers have sort of a relief valve if costs get very out of control.
You have also said that your plan would help those with acute illness receive continuing care through their doctor. We've heard stories of some people, not cancer patients, losing their doctors. How would this work?
So if you have a plan terminated, either because they're no longer offering product in the market, so a Blue Cross customer, or because they're no longer offering in your particular county, then you would be able to go to a new plan but keep your old provider for 120 days, and the state would pay the difference in cost if your old provider didn't accept the new plan's payment rates. It all gets really complicated, but when it comes down to it, what we're saying is we understand there are acute, serious cases of both physical and mental illness, and we want to give a 3-month smooth transition so you become comfortable in the new provider system. And if you're in the last 6 months of your life, we're going to leave you in your old provider system so that you get that continuity and familiarity in those last critical 6 months.
Can you explain the reforms focused towards employers and small businesses to provide options for their employees? And I've heard MEWAs thrown around, and I don't know if this relates or not. If you could talk a little bit about that.
What we've done, several provisions. There's a new federal law called a defined contribution plan. We've got conforming language for that so that if an employer doesn't want to have to shop for insurance for their employees and become a benefits manager, they can contribute money to an account, and those individual employees can go buy insurance that meets their family's needs. Secondly, we're lowering something called the stop loss provision, so nerdy insurance talk, but it allows employers to reinsure at a different level than they currently can so that they can have more flexibility in the health plan options they offer their employees, hopefully lowering the cost for those small employers and letting more employers offer better benefits so they can compete with the larger corporations here in Minnesota, frankly, and attract the talent that they need. And then you refer to MEWAs. We have a small MEWA provision in this bill, and it's important, but it only impacts one part of greater Minnesota's economy primarily. Our agricultural co-ops have been long-standing stable groups, and they would be able to form a large insurance pool that would have more flexibility than individual farmers buying on their own. And so we're hoping to help out the folks in greater Minnesota, small businesses in greater Minnesota and the metro, hire the talent they want, have easier benefit plan administration. So small steps. These are just the beginning of what needs to be done, but we want to take serious small steps going forward, and we hope that we can get the governor to come on board with some of our ideas. We look forward to the weeks to come.
Can you gauge I want to gauge your confidence level. Open enrollment closes January 31st. Do you think something will be in place by then? We
are moving this process so quickly, and some people are very frustrated at how quickly we're moving this, but like a disaster, you know, if we had 250,000 Minnesotans with their basements flooded, we would be moving even faster than this. We don't want to just hand them a check to fix the basement. We want to make sure that the cause of the flooding is also taken care of. So we're trying to do two things in a very fast, thoughtful manner with as much transparency as we can in a short period of time. We're going to do everything we can to get the governor talking with us.
Senator Benson, I know how busy you are. Thank you so much for coming.
I'm so grateful for your invitation. Have a good day.